So you're about to go into surgery now, and I'm going to be speaking to you in a minute, but I want to give you some information to think about, that when you hear these things during surgery, you're not going to be surprised. So we're going to be doing LASIK for you, where we're going to make a little flap and then do the correction. So you'll be lying on a bed, on your back, looking up at the ceiling. And this bed moves between the two lasers. So once you're under the laser that makes the flap, you know it uses air bubbles to make the flap. Once you're under that laser, you're going to see a circle of white light. And then we're going to raise the bed and bring you closer to the circle of white light. And once you're under that circle of white light or looking into it, it looks like a tunnel. Most people will be closing the eye we're not treating. So all they're seeing now in front of them is the tunnel. And then what they won't be seeing, because it's transparent, is this little plate that comes down. And this little plate is going to touch the surface of the eye. And at this point, all you feel is a gentle pressure feeling. And now the laser knows exactly where you are. And when the laser starts working, it goes dark. So if your other eye is closed, it's going to go completely dark in front of you, and that's fine. Most people like the idea of not being able to see what's happening at this point. But all you do at this point, it's really important, is in your mind's eye, just imagine you're looking straight ahead. So my eyes are closed now, but I know I'm still looking straight ahead. So that's all you need to do in your mind's eyes, look straight ahead. Once that is done, and the vision comes back, it's very hazy, because you have 2 million air bubbles in the cornea. Now the bed's going to move across to the other laser, and the other laser is going to look familiar to you. And the reason it's going to look familiar is we're going to set up under this laser. We're going to take some measurements, make sure your eye is numb, put the small little device in that's going to help keep your eye open under this first laser. And once you're back under the first laser, even through these air bubbles, you'll see the target. And the target now is a small little green flashing light that flashes every second. And this green light's directly in the center of 4 big white lights, and they form a rectangle. So if you ever miss the green light, all you do is look to the center of the 4 big white lights. And now when the laser starts working, it's going to be working for anything from 2-3 seconds to 20 seconds. And at this stage, I'll tell you exactly how long it's going to be. While the laser's working, you're going to smell something that smells like it's burning. Nothing's burning. The laser's a cold laser. You're just smelling particles of cornea that are being removed. The second thing you're going to hear is a buzzing sound. And then the third thing that's going to happen is you're going to once or twice, or perhaps even more times, you're going to ask yourself, am I looking in the right place? And that's something you needn't worry about. This laser's firing 500 shots every second. The tracker that's following your eye is working at 1,000 times a second. So the truth is, try as hard as you like, you can't get a bad treatment. Is whatever movements you're making, the tracker's going to follow you. And the laser will only deliver a pulse if it knows you're in the right place. And in fact, it's twice checked you're in the right place. So the cycle that the laser goes through is the eye in the right place? Yes. Confirm, release the pulse. And if you happen to look away, it stops firing. And once you're back in line where it can track you again, the laser will track you. So you could be watching a football match, you could be reading a book, and still the laser will deliver every pulse in the right place. So I'm going to see you soon, and all the best for a great procedure.